My name is Becky Woodiwiss. I'm one of the public health team employed by Brighton and Hove City Council. And as you might imagine, we've been slightly busy with COVID-19 over the last several months. And we're wanting to give you a bit of a background about the situation in Brighton and Hove and answer any of your specific questions. Suzanne.
Hi, my name is Suzanne Morris. I'm a nurse consultant in infection prevention. My role within Brighton and Hove City Council is giving infection prevention advice and guidance in relation to rough sleepers and single homelessness.
Thank you. Do you want me to start with the first set of questions that we've got that come through?
We could do that, or I could show you some of the data if that's helpful for people.
Go with that first, yeah.
Okay, should we do that? I'll try and share my screen. So,
Okay.
Okay. Right, where are we? Okay. So the council web pages is where we try to put everything for everybody, not only for the members of the public and for the staff, so that they can easily find information that they want to look at to understand around coronavirus. So one of the first things that we update every few days is our local statistics, which I thought might be helpful for people. And okay, so okay. Also, we've got information while that's loading. Oh, here we go. That's better. Okay. Currently, we have had, we are at what's called yellow at the moment, but let me take you through to the confirmed cases table because that's the easiest thing to understand. Okay, so this is where we put our number of people who've got COVID and have had COVID data. So you can see we started back in February, and then this was the peak over the March and April period. Then we had a bit of a downturn and a bit more of a blip in May as we got more data around the testing come in. And then we've had several weeks where we've had nobody testing positive, but just recently it started to go up a little bit. It's stabilized a bit now. And some of that might be due to the fact that some of our opportunities for getting tests have been slightly more limited as they've reprioritized the testing slots and kits for other areas of the country where there's higher numbers. To date, we have had 1,000 people who've had confirmed tests. And this gives us, we compare using a rate per 100,000. So we can compare different populations. So our cumulative rate is of 355. And that compares to the Southeast local authorities of 455, or the England authorities of over 600 per 100,000. But that's numbers to date. So obviously some of those people will be well again. However, in terms of our, perhaps a better measure for us to see what's happening locally is to look at the last 7 days. So we had 29 cases confirmed in the last 7 days. And again, we do a rate per 100,000 so we can compare against different areas. And we're 10.0 at the moment. And that to compare for you, Southeast rates are 10.5 per 100,000 at the moment, but the England rates are 40 per 100,000. So you can see we're running along lower than the England average. The other data we have and we keep here is sadly our deaths data. So this table shows you what deaths there have been since the beginning of April, beginning of the year, excuse me. All these blue-grey bars are deaths anyway. The ones with the little yellowy orange tips, the ones where COVID is on the death certificate. And this blue line here is a 4-year average of what you would expect for deaths. So we've had 166 deaths, sadly, in the city due to COVID-19 since the start of the pandemic. The other data that we often use to try and help us understand what is happening locally is the number of people who've called the NHS 111 or 999 or gone online for 111 to ask about symptoms because they're feeling really poorly. Okay, so we use it as an indicator, are people feeling iller and calling more to get help? So to date, in the last week, in total, there have been 647 people contacting, all 3 of those from the city, to try and either speak to somebody about the symptoms they have or ask what they should do. So it just gives us another little way of indicating what's happening for people in the city. So that was the data I was really going to show for people. I shall stop sharing my screen. Okay. I wonder if people would be interested in having a little, some of the sort of more technical summary about the coronavirus, or whether, but I think we could probably do a little bit about what we know and what we don't know at the moment as the present state, as we are at present. I mean, we obviously know coronaviruses are quite a big group of viruses, causing things like the common cold, one of the types of common cold, all the way through to something more serious like SARS. We have learned a lot since the first cases, nationally and in the city, about how to treat and look after people and the types of people who are at higher risk of the worst of symptoms to do with coronavirus. So people with other health conditions, older people, people living in difficult or in very poor circumstances, whose immune systems might be less able to resist the negative effects of the virus. We thankfully know that younger people are a bit protected from the negative effects of the virus. And what I wanted to say about that in terms of our statistics, you will have all read in the paper that a number of the cases that are positive at the moment are in younger people. And it is true to say at this point in time, nearly half of our positive cases over the last week or so have been in the 17 to 24-year-olds. So we're working very closely as a council with the youth services and groups of young people and student bodies to try and devise information and advice and guidance that speaks more and is more relevant and poignant to young people, to help them keep themselves safe and keep their friends and families safe. We know that, and I wonder, Suzanne, if you'd like to say a little bit about the infectious period of the virus, so that people understand why the timeline of 14 days is quite important for self-isolation.
Sure, no problem. What we know so far about this particular virus is it's got a incubation period, which means you acquire it, and the length of time it then takes to show symptoms can vary from 2 to 3 days up to about day 9, day 10 of being exposed to somebody who has the virus as an infection. Most often, if you've acquired it, you show symptoms around day 3 or 4. You can be infectious for up to 3 days prior to developing symptoms. So hence why, if you are symptomatic and you go for testing and you're positive, Public Health England will contact you and ask you for people you've been in contact with, close contact with, for at least 3 days prior to your symptoms developing. And then that will go through into the NHS Test and Trace app, and they will make contact with all those people that you have had contact with through their risk assessment with you. And those individuals then will be asked to self-isolate for up to 14 days, because that's how long it could take you or your contact to develop symptoms. There's no requirement for a contact of a contact to self-isolate. So if you are an individual with symptoms and you have got family living with you, children, husbands, etc., then those individuals have to self-isolate up to 14 days. You as the individual, if you are positive, self-isolate up to 10 days. Any external contacts that have had contact with you, like at work, if they've had close contact with you, would have to be isolated, would have to self-isolate up to 14 days. If you are a contact of somebody who's symptomatic and being told to self-isolate by the NHS test and trace, that is for 14 days. Public Health England or NHS test and trace will contact you to tell you, we want you to self-isolate. They're the only two people that will ring you. People from work can't tell you to self-isolate.
And Suzanne, thanks, that's great, because that leads us nicely into a bit more about testing. And I think the contact tracing detail questions are going to come up in our answers. We'll answer some of the detailed questions that have already been presented to you, Billie. Just very quickly about the issue of testing. The nearest drive-through is at Gatwick at the moment. It must be said, all tests have to be booked either over the phone or online, and that's really important because it gives us a sort of flow through, and you just have to keep checking. Sometimes there aren't tests locally available in the morning, but by the evening some of the testing slots have been released again. So the nearest drive-through is at Gatwick. There's a mobile testing unit at the moment at Gscene for the next week, and we're piloting what are called drive-to or walk-through test sites in the city. And some of you may have seen the article in the Argus, and that's great because it's adding to our options for people. And of course, people can order home tests. But the message really is on that, keep trying. Because they've had to prioritise other parts of the country, they release the test kits and the test slots at different phases over the course of the day. So if people are worried about their symptoms, please go online, and all the contact details are on our web pages, and we'll put the link in the chat later. And then you can book yourself either a test to go and have one, or to have a home test sent to you. Okay, so also locally, as part of our response to COVID-19, we've been working very closely across all the different parts of the system. So we work closely with our health partners, we've worked with a lot of community and voluntary groups, and also been trying to inform the public at every turn and putting information out again on our website. We have what's called a local outbreak plan, which tries to explain what is our system if we're worried about a case that comes up, for example, in a care home or a hostel, such as Suzanne might work on, or in a school, or what about individual people, etc., etc. It does describe what we do there. And as we mentioned, we have an escalation framework that goes from green through yellow to amber to red. And when we get to the reds, that's when the government start deciding what we need to do, rather than we as a city and all the residents and services in the city work to try and keep people safe and help people self-isolate or look after themselves if they're not well. Is it useful to go to the questions now, do you think, Billie?
Sorry, I was just unmuting myself. Yeah, now we can go to questions. I'll read them out as they've been sent to me. So the first one is, why is the website tick boxes for the testing so gendered? It only says gender, man or woman. This is so old-fashioned and offensive, and erases me as a person, and fails at the first point to reassure me that I'll be treated with respect. I am non-binary. Please get this changed. This must put so many queer people off of applying for a test.
Absolutely, and I've written to both the NHS testing website and also the test and trace website with this very question. Why is it so binary? And what are their plans for changing that? And how does that work for people who are in the process of changing their name? And I have actually written to them, and I'm waiting on a reply at the moment. So we're very conscious of that. all the paperwork and forms that we require as a council and other parts of other services in the city have more options than that, as are we required to do under the Equalities Act. So I'll let people know as soon as hopefully I'll receive a reply saying they're in the process of changing that. If and when I know, I will come back to you.
Would you like another one? Or Suzanne, would you like to have an input on that question? I'll just wait. I'll go on to the next one.
Sorry, I just had to find my button.
That's all right.
I believe Becky is the best person to answer that question because she has the, within her office, the emphasis to push that within the NHS and DHSC.
We are on the case. Let's hope my several letters and reminders actually start prompting the services to think again.
Okay, I'll go on to the next question then. I have symptoms, but I'm worried about test and trace, as the only people I've been meeting as contacts are by Grindr. No phone number or address. I want to do the right thing. Can I be given a link to the personal message to share by the test and trace team, share with them via Grindr or Scrub, which can preserve their anonymity?
Anonymity. Okay, there are many instances when people don't actually know who they have been with. So trying to extrapolate a little bit from that circumstance for that person. So, for example, if you're on a bus or on a plane and you ring up and you contact test and trace, and because you've got symptoms and you have a positive test, and you have to explain that I've been with people and I don't know who they are and I don't know how to contact them, which is sort of similar to this person's situation. You don't know how to contact them except that one way. So test and trace actually say on their website, if you don't know the person you've been with or how to contact them, talk to us and we will help you think it through. So it would make sense to me that that person could contact test and trace. And first of all, they need to look after themselves and go and get themselves tested to make sure that it is COVID or it isn't COVID. Secondly, they should actually say to test and trace, I have been in contact with people, I don't have emails and names and addresses, but I could share a message, and they hopefully will be able to provide such a message. Because there must be many instances in other situations where again, if you were to go to a pub, you'd know you've been in the pub, you don't actually know how to contact those people. So hopefully that's a helpful answer. But first, the person needs to look after themselves and go and get themselves tested.
Okay, thank you. Okay, so the next question. I'm trans. It's very important that people who contact me and speak to me have some understanding of the diversity and trans identities. Have all the test and trace teams had this training, so I'm not at risk of assumptions made about me by the way I sound or misgendering from the contact teams?
Okay, well, the test and trace website says that the staff have all had equality, inclusion and diversity training. Now, we all know that that can be very, very brilliant and very well applied, and sometimes it's a bit more variable, but they have all had it. It does say that. So I would hope that they will be suitably respectful and sensitive in their communication. And there are different levels of contact tracing. It might be worth actually explaining this at the moment, and people will probably be aware because there's been a lot of stuff on the telly and in the news, that there are 3 levels of contact tracing. So there's level 3, which is basically a phone call, a phone contacting. So they will be trying to speak to the case, i.e. the person who has a positive test, and find out who they've been with and when, and try and begin to understand whether they were infectious, who they saw when they were in the infectious period. And then they will telephone the contacts or email the contacts or text the contacts or provide text for the case to send to the contacts, whatever it takes to provide the right advice to those contacts. The level 2 of contact tracing is where where either the person, they can't get hold of the case, or they're concerned about some of the contacts where they maybe work, and it needs a bit more investigation. And people working at that level will often be people who've done contact tracing as their job. Maybe they're retired, or maybe they've changed careers, or they have that bit more training and a greater understanding of the complexities of people's lives and how you judge how it's just that bit more advanced. And if certain of the cases work in certain settings, they're directly referred up to the level 1, which are the specialist health protection teams, who are based in Public Health England, and they're based on a regional basis. So we work really closely with them. And the types of individuals who might have a positive test who get referred directly up there, who work people who maybe work in a setting where there are lots of vulnerable people. So a care setting, for example, or a school, for example. And, or maybe there are other complexities involved in that person's situation, and they do more investigation and will contact people and provide them with more direct advice and support. Hopefully I've covered all the bits on that.
Thank you.
Haven't missed anything, Suzanne? I'm just checking with Suzanne. Okay.
No, you've covered everything.
Okay, so next question. How long will you have my contact details for, and who are they shared with?
Okay, so first of all, if somebody is symptomatic, i.e. if they've have definitely got COVID, or they've registered as potentially having COVID, their data will be kept for 8 years. And people who don't have any symptoms but are a contact of a case but don't actually end up being ill, their data will be held for 5 years. The reason for that is really important to understand, that it's about developing understanding of this particular type of coronavirus, COVID-19, and understand it. And we sometimes in medical research, you have to look back, and you have to look back at the people who had that condition and what happened to them over time, etc., etc. However, having said that, the data is governed very tightly and carefully by a lot of rules relating to the GDPR, the General Data Protection Regulations. And the data is, people's individual data is kept very confidential, and wherever it can be, it's anonymized. But you understand, obviously, to track somebody down, you actually need to know who they are, and to follow up their contacts, you do need to know who they are. However, the information is only shared where it's absolutely necessary for the protection of that individual or their contacts and their health and well-being. So and our website has a full explanation, and in a minute I'll show you a full explanation as to what happens with the data and how it's held and who keeps it. And you can write in and say, I want you to remove all my data. And you can write in if you've got any particular complaints or concerns or worries about your own personal data. So I will try and find it. Maybe we can go on to the next question while I have it.
Yeah, of course. So the next question, will I have to tell my partner if I've been contacted by Test and Trace? One of my hookups contacts me. This will be difficult. We do not have an open relationship. Will they need to self-isolate?
I can answer this one, Beck, while you're doing that.
Thank you, while I'm looking.
Yeah, no problem. So you have been in contact with somebody who is symptomatic, and you have been contacted by Test and Trace or Public Health England asking you to self-isolate. Your partner doesn't have to self-isolate because he's not a contact. Whether you choose to tell your partner or not is entirely up to you. That's your decision. We, as people who are dealing with the situation on Test and Trace, we do have no right to tell your partner, and he won't or she won't hear from us. Does that answer the question?
Yeah.
Yeah?
Yeah, for me.
Yeah, it's you as the individual, your personal choice to whether you tell your partner or not.
Yeah. Okay.
The only other thing I would add to that is, of course, you might go into a pub or a shop or another venue where there may be other people. And now that we've got the QR cards, or you have to register, put a name and a contact detail, they might have been contacted, completely nothing to do with a hookup, to do with another part of their life, another contact that they've been nearby, somebody else. It might have been in the pub, for example, or in a shop, or a small shop, or somewhere where there might have been a note of who you are and where you are. Okay. I think I'd quite like to show the screen, if I might, about our test and tracing. Is that okay? And then we can take a few more questions. Here we go. Okay, so what we've done, we've put in quite a lot of information here for people, which I hope they'll find reassuring. So it talks about what contact tracing is. Obviously, this is something that people have been doing for ages. So like the health protection team have, environmental health officers do, for example, if there's a food poisoning outbreak, the sexual health teams have been doing for years. And again, we describe what a contact actually is. And they will, when you contact test and trace, they will, you know, sort through all your contacts and think about the ones that are most likely to be at higher risk, depending on when you were infectious and how long you spent with them and what your circumstances were. But they will help unpick that for people. And then it talks a little bit more about what you do when you self-isolate. Self-isolating is really important. It's one of our best bets for managing this virus. And there are now systems in place that we can directly help people self-isolate if it's difficult for them. And the government have announced a pot of money for people on low incomes who can't work from home, or who have been threatened by their bosses that they'll be made redundant if they don't come in, etc., etc. And the council does have a central point of contact for help if people feel that they're struggling to self-isolate. It is so important, the self-isolation, and sadly the national research indicates that quite a lot of people actually aren't doing it. And it is, like we say, it's really crucial for helping everybody remain well and healthy. Let me just move our picture. So some of the concerns that people have that have come up were about identity, and we didn't cover that yet. Actually, if I'm a contact of a case, I won't be told who that case is because of data confidentiality. So if you are the original, the positive person, your case, your friends and contacts won't know. So that's quite important to remember and be reassured, hopefully, by. And in terms of what happens, your communication will always either be from this number or a text message saying NHS tracing. You won't be asked to ring a premium rate number or make any type of payment over the phone. Please be reassured about that. And again, we will put the link into the chat in a minute so that you've got this link for everybody here. And this is what they will ask you. And again, they will help you if you don't know who you've been in contact with for all those, or you've been in contact with people, but you don't know how to communicate with them other than maybe through a networking app of some description. And they will help you work through that. And your information will be protected and shared, and it explains here where it goes and what happens and how long it will be kept and where it might be used. So there's quite a lot on the website and what you can do if you're not happy about that. Okay, so hopefully that is reassuring for people. I will stop sharing at that point. Okay, do you want to ask us another question, please, Bill?
Yeah. Okay, so can the staff of the sexual health clinic do the test and trace rather than the commercial teams, as they have experience of dealing discreetly with ways to contact people?
Absolutely, they do. And right at the beginning of the whole COVID outbreak, it was interesting because you've got these three professions who do it as their bread and butter, but actually a different system was set up by the government using different contact tracers. And so they can't because they're not commissioned by the government to do so. But it is interesting because they do have good skills in that field. but they won't be doing it.
Can I go with the next one?
Yes.
Okay, I'm not out. I'm living at home. My parents are hostile to any LGBTQ lifestyle. If the test and trace team contact me, will it only be me they contact, or will there be a card through the door or someone else contacted from my household? We only have a landline at home.
They will only contact you. They won't contact your family. But it does get more difficult if people don't have a mobile. I don't know, maybe they will. Do you know, Suzanne, do they write to people?
I'm not aware that they write. If they use the landline and you're not there, they will not tell your parents. They will just turn around and say, I will ring back at a later date or a later time. So they'll only give a result to you, the individual that they need to contact, because they're covered under the data protection and health protection of sharing confidential information.
The other thing also to remember is that you can use a trusted other person or a proxy, or for people for whom English is an additional language, they can use an interpreter, somebody that you trust out of your home maybe, that you could discuss it with and say, would you be prepared to receive my results from my test, or act as a sort of advocate for me in this process, because I only have a landline and because I don't feel comfortable in these discussions in my family context. And I think we've definitely covered that on the website. Next question.
Okay. Has the track and trace team had proper training around dealing with gay lifestyles? If I have to share the names of people I'm meeting, I want to be sure that they will be treated with respect and not cross-examined about behaviours.
We know that they've been, we've already said that the test and trace, because that's what they're officially called, because we're testing people, tracing their contacts and tracking the virus. So test and trace have had equality, inclusion and diversity training. So I am hopeful that everybody will be treated with suitable respect.
Thank you. Next question. I've been to some chemsex parties and I'm worried about how to best deal with any risks of infection that might come from these. STIs is simple, the clinics deal with them. We don't want police involved or any kind of official or legal attention. For any way of sharing anonymously, you need to go and get tested and isolate info without sharing people's contacts over.
So the individual is the case, person worried about their symptoms, they must go and have a test to rule it in or rule it, to rule it in or rule it out. And in terms of providing their, they then need to provide their contacts to test and trace. And remember that all those contacts won't know where it's come from. There won't be any way of knowing that it was from the person at the chemsex party. It could have been somebody from the pub. But one of the things that we do say to people, if you do know people and you are comfortable communicating with those people, you should alert them to the fact, so they're prepared and ready to have test and trace contact them. But the more we go out and about in terms of going to pubs or going to shops or going to other places, the more contacts we have, so that increases the number of routes that you might end up coming across somebody who has a COVID positive test, and therefore test and trace might contact you for a different, from a different route. So I think they should not be too worried about that in terms of it revealing where the contact, who they are as the contact, if you see what I mean. I think you'll just get a note saying this is test and trace. Somebody you've been in contact with has had a positive test, so you will need to do X, Y, and Z. Suzanne, would you say that's the case from your experience of working with people who maybe haven't felt so confident about sharing parts of their lifestyle?
Definitely. I would agree with all of that. And we only contact the individuals that have had the close contact with the positive case. So, you know, that is in time as well as space. So if it's somebody that was in the establishment and was some distance and never came near you, they won't be contacted. It's only those that are very closely contacted to you.
Which would include sexual partners.
Yeah, unless you're doing it from a distance of greater than 2 feet, which I don't think you are.
It's a bit more tricky.
I think so.
But as I said, for the contact, they'll get that thing on their phone and they won't know from where did it come from. They won't know who the positive test person was.
And thank you. Next question. I'm a sex worker working in clients' homes across the city, mostly men who have sex with men. Most of them would not wish for anyone else to know how they know me. Some are not out to their partners, and discretion is an important part of my business life. If I am contacted or need to test, how can I best go about this without risking anyone else's lifestyles or exposing them?
So that's sort of the same question as before, isn't it? So the clients, the sex workers' clients will get a message on their phone saying somebody you've been in contact with has had a positive COVID test. Can you contact Test and Trace so we can advise you how to keep yourself well and safe? They won't know that it was from their sex worker encounter necessarily. And it goes to that individual's phone or their email, however it works for that. And theoretically, that does limit the number of people who might see that communication. So it is important to tell Test and Trace who you've been with for everybody's health and well-being and keeping people safe and stopping people from getting ill. But it will be handled carefully, and I guess that's the conversation the person should have with the Test and Trace when they speak to them. I have a delicate career, and I want you to, I need to be confident of how you're communicating with my contacts.
Thank you. Next question. Is it safe to have casual sex at the moment? The advice from THT, seems to be that it is. I have not met anyone for more than 7 months, and the lack of intimacy and basic human contact is making me ill and depressed. Can household bubbles be 1 or 2 regular sexual partners? Do you have any advice on how to have casual sex more safely?
I had to look it up on the THT website because obviously sex is a very intimate and close experience. Remember, the way that the virus is transmitted is through breath, mucus. It is present in wee and poo, basically, but we don't know whether that works as a transmittable route, but we definitely know it's in the breath, the mouth, the mucus, and therefore things that people's breath and mucus might touch. So you want to limit that. In what you do, you want to limit it. So you might choose non-face-to-face positions. You might wear a mask. The most important thing, as with all sex, is to have a conversation in advance. You don't want to enter into any kind of sexual relationship if either of you feel ill, for a start. And certainly if you've got symptoms that might be COVID symptoms, or you've been in contact with people who might have COVID. So there's a conversation to be had right at the outset. You know, it's responsible. It's what we need to do as adults to keep each other safe and well. And it could be that you consider the sexual practices that you're doing to try and limit the amount of aerosol, mucus, and surface, and remember to wash your hands, very important, hands, face, space. In the incidence of sex, you can't limit the space very well, but you might be able to manage the other 2 aspects a little bit better. Obviously, people's mental health and well-being has been an issue and a concern throughout the whole COVID process, people have been quite isolated socially, and it has had an effect on people's mental health and well-being. So we need to be sensitive about that too. However, sex is a very close up personal behavior. So I guess it's a choice people might want to make. I would hope people would think twice about it and maybe think to leave it a bit longer till we know more about the virus. Suzanne, is there anything else that stands out for you that I might have missed in that?
No, I think you covered it. As you said, you know, the main route is through respiratory secretions that we know of for this particular coronavirus. We do know some other coronaviruses are spread through the fecal route. We know this virus is in the feces, but we don't know if it's actually spread by that route at this moment in time.
In your usual specialist nurse practice, Suzanne, do you advise people against having sex as a general rule?
Unless they're with established partners, yes. So one-nighters, especially because of the more frequent one-nighters you do, the higher the risk of not only for coronavirus, but also for other infections.
Yes, because we must keep ourselves safe generally. Remember our basic good sexual behaviour and health behaviour anyway. The last part of that question was about having sexual partners in a bubble. So the idea of a bubble was introduced when when it was very clear that there were some people maybe living on their own, and how lonely and isolating that could be. And the idea being that they could pair up with another household or another person to be each other's support. But the idea with a bubble is you have that bubble and you stay in it. So it might be you're a single parent with a small child and you team up with another single parent with another small child and you are your bubble. It might be that you're one adult in one house and a house with maybe two people in it. And it could be that one of the relationships that you have could be sexual relationships as a methodology of support. But you have to stick to that bubble. That's the point of it, really. And you stay in that bubble. And you could, like I say, you might be in two different houses, but you are each other's support and you are each other's bubble.
I was just going to emphasise that bit, Becky, that the bubble is a bubble. It's not 6 bubbles that you have a link into. It's one bubble.
Okay, thank you. Next question then.
Okay, this is the last one that I've been sent so far. So, are there any plans for an LGBTQ testing centre? It's very difficult for me to go out into spaces which are not LGBTQ safe. And I would welcome somewhere I could go where I know the people there will understand me and the way I choose to live my life at present.
There aren't any plans for that per se that I'm aware of. The whole test and trace program is overseen and managed by the Department of Health and Social Care. So, and we are just the conduits to help it happen, things happen locally. And we don't have as much say-so and influence as we might have were they our local sites that we set up and we oversaw. So I guess that's a question for the Department of Health and Social Care.
Can you see the questions that are coming up in the panel?
Okay, sorry, no, I didn't have my chat on. Okay.
There are some other questions that have
Stats website. Absolutely. Okay, so the Stats website and then the guidance around sexual health. Yeah, okay. And then people were saying it's not fine to have casual sex. Yeah. And that's exactly what Suzanne said. And we were saying it is up close and personal. There's no way around it. And we wouldn't want people to come in contact with COVID without due care and thought. I wanted to just end on something, if there are no more questions. I just wanted to say some of the positives. We've learned quite a lot about how to help people remain well and keep them safe. And we know the simple messages of the hand, space, face is really important. Keep washing those hands, keep your 2 meters apart, your wingspan, as it were, and wear your face covering. And the face covering is to protect others from you and you from others. But mostly it's about your social behavior, your politeness, if you like, to keep your respirations to yourself. We know that self-isolation is really important and really works if people do it properly. But if people do find it difficult, or they're worried about their employment, then there is this additional payment from the government now. And it is means tested, but it will be available through the council support hub, which I will put up in a minute. We are understanding that a percentage of people don't get any symptoms. And again, that reiterates why the test and trace element is important, and people self-isolating even if they don't feel ill. And we don't quite understand how that works, or what percentage of people don't get symptoms. We know people who are younger get fewer symptoms. So we are learning quite a lot. We know that there will be more testing available, which is good, that's coming online, and testing is really important. So if people do feel ill and their symptoms, and remember the symptoms, so it's a high fever, a continuous cough, a loss of taste and smell. Other people have other things like headaches and the such like. Keep an eye on the symptom checker. There is information on the government website on that. And research is going on all the time, because sometimes symptoms are different in different age groups. So we do know quite a bit, and we have got good systems, a partnership working in place in the city to try and help people and keep people healthy as well as they can. And on our website, we've also got the wider aspects to help people remain well in these uncertain times, which are unnerving. So there's some health and wellbeing information on there, and guidance on exercises you can do at home, or mental health support that you can get through the internet as well. I'm trying to think.
Becky, can I just jump in there?
Please do.
2 points from me. We do know that transmission is greater for individuals who are asymptomatic. So those that are asymptomatic, they can still transfer it to others, but they don't seem to transfer it to others as much as what it is with people who are symptomatic. The second point is in your face covering. You need to clean your face covering regularly. The recommendation is to clean it daily. It could go in a normal, most of them can go in a normal washing machine and wash with your other clothing at the normal temperature. Some of them don't tolerate being tumble dried or ironed, but you need to deal with it as if it's a piece of your underwear and change it daily. Don't keep putting it in your pocket, taking it out and put it back on the next day, or in your handbag, or in the wing mirror, not the wing mirror, the mirror on this car that I've seen them flapping around when I'm driving. Back to you, Becky.
I'm just putting in the chat the links to the council website. So I've put, they're all pretty much on the same page, but just different parts of the page. So that's the test and trace and testing information. There's also the statistics. I also want to just say that we have been trying to make sure we include information that's available in translation as well, because it is important that all parts of our community can access this information to understand the situation. And our advice can be in terms of understanding how test and trace works, understanding how keeping people safe, and following the self-isolation guidance, how important that is. So again, we've put the links on the website. And the last link I will add on in a minute is about I've completely forgotten. Yeah, there's another one I wanted to put on for people. Oh yeah, how you get help if you need it, especially thinking of people who might find it more difficult to self-isolate, and how important that is. Yes, so the requesting help for yourself or someone else is the last and very important bit. It's a Friday. I blame it on being a Friday of an exhausting week. Okay. Yeah, so remember your hands, your face, and your space, really important. And do have a look at the test and trace. It's a really important tool for us to help manage this virus and try and have some normal life. We need to really be alert to what we need to do individually. To keep
Becky, it's Sue again. Just got to cut in there where you were talking about covering your face. Remember, your face covering must cover your mouth and your nose. We all breathe through both of them.
I've seen some classic ones with people with just
over their mouths or on top of their head as if they're a whale. It doesn't work. And if you put it underneath your chin, technically, you're meant to take it off and put a clean one on, because you've got it all contaminated and you're bringing that back up against your face again and putting yourself at risk as well as others. And when you take them off using the pieces that loop behind your ears. I don't think you guys could see me practicing here. You unloop them, stretch them and pull it forward. Because if you touch your hand on the front of it, you're going to get your hand all contaminated. And the likelihood is once you've taken it off, you'll rub your nose or you'll rub your eye. And if you've got a virus on it, on your hand, you've now passed it to yourself. So once you take your mask off, decontaminate your hands, use some alcohol gel.
And remember your 20-second hand washing.
And the other thing to remember on the alcohol gel is make sure you put enough on it to get all of your hands wet. If there's a dry bit, the alcohol will not have killed the virus or the bacteria that's on that piece of skin. It's got to get wet for it to kill it. And alcohol does kill coronavirus. Some of the non-alcohol rubs don't. They just delay its ability to replicate.
Billy, is there anything more you want to ask us?
No. And I'm just looking in the panel, the chat. There's no more questions. So thank you. If there's anybody there that wants to ask one last question before we wrap up, then please do send it through. But no, nothing.
Can I just ask from the stream of chat, are people able to access those website links, or is there a problem? Do the links only come to the panel, or do they go to everyone?
I've reshared them to the attendees as well. Yeah,
thank you. And obviously people can come back to me if there's anything they want to be clear up. And if I find out about the gender, just the binary gender box at the testing, I'll come back to you because that's important.
Thank you.
Stay safe, everyone. Have a good weekend.
Thank you to Becky Woodiwiss and to Suzanne Morris. Thank you very much.
Thank you.
Good weekend.
Bye.
Keep safe.